We have three people just to give us a welcome to start off with at the beginning of this session, okay? And I'm going to give them their names in order. So if I say, now, I'll apologize, Anna, if I get this wrong. Anna Marzec-Bogusławska, thank you very much, who is director of the Polish National AIDS Foundation, who's going to talk first. Then we'll have Sebastian Köhn from Open Society Foundation, whose generous support is one of the organizations that have made this conference possible. And finally, Daniela, Rojas, Castro, who from AIDS and Coalition Plus, who is welcoming you on behalf of PrEP in Europe. So I'm going to hand over now to Anna. Come up and say a few words, Anna. It's great to see you here.
Good morning. By the way, you pronounce it perfectly. Thank you very much for this. It happens not very often. Good morning, dear colleagues, friends, and participants of the important summit. On behalf of the National AIDS Center, which is agency of the Ministry of Health here in Poland, let me give you a warm welcome. As you can see, not now, but outside, we ordered also good weather, so we are in place with this. I hope that you will have also some time to visit Warsaw and to go around. But let's come to the topic of this important summit. As you probably know, Poland is seen as a leader here in the region for its achievements on ARV treatment. And let me assure you that also all Polish professionals support PrEP. It is very important, and I remember that when we started work with the National AIDS Treatment Program, next edition, which was designed for the years 2017-2021, and we started work on this in 2016. We really care that PrEP will be covered also by one of the chapters in this important national document. So we have PrEP on our National AIDS Treatment Program, and unfortunately for the moment, Poland is not able to cover all the expenses, but I think that having PrEP in our National AIDS Treatment Program was a good start, was the beginning of PrEP in Poland. So I hope that with time we will be able to extend the systematic solutions related to pre-exposure prophylaxis, even if for the moment patient has to pay for it. I was told that I have only 5 minutes that probably I consumed already, so I wish you fruitful time professionally, and also enjoy the time in Warsaw. Thank you.
Hi, good morning, everyone. My name is Sebastian Köhn. I'm the Director of Sexual and Reproductive Health and Rights at the Open Society Foundations, which, as Gus mentioned, is one of the financial supporters of the summit. For those of you who don't know, the Open Society Foundation is a global grant-making foundation that provides financial support to civil society organizations. when I say open, well, with the intention of advancing open societies, when I say open societies, I mean sort of distinctly anti-authoritarian societies where all of us have both the possibility and the responsibility to be part of decisions and discussions about things that affect our lives. So when Gus and the PrEP in Europe team reached out to us for support, we sort of sat down and came to the view that PrEP is actually, in public health, I think, one of these kind of flashpoints or a really great opportunity to have some critical conversations about who is included and who is excluded in care, in research, in policy decisions. Also to have conversations about, who determines access, who determines cost when it comes to both prevention of HIV and also care more generally. So I'm super excited about the program here. I think I'm particularly, so in our SRHR work, we focus on a very sort of small sliver of SRHR, which is sex worker health and trans health. So I'm super excited to see, questions around access to PrEP and policy for sex workers and trans people on the agenda. Want to wish you all a really interesting and hopefully a very challenging summit as well. Thank you.
Hello, everybody. So I have 5 minutes, Gus. Dear colleagues, activists, researchers, community representatives, policymakers, and health professionals, dear friends, it is my pleasure to welcome you on behalf of the Steering Committee of the PrEP in Europe initiative to the second PrEP in Europe Summit, a summit that starts the day after Spain has announced the authorization of PrEP, so congratulations. For those who do not know me, I am an activist and a community researcher. I was an active part of the community mobilization at ED and of the INRS IPERGE project that led to the authorization of PrEP in France in 2016. And my implication continues today through mobilization and research at the INRS Prevenir study, together with Jean-Michel Molina and Jad Gunn. I also work with Kai in a Flash PrEP in Europe survey that most of you know. Most of the PrEP studies are and were motivated by the desire to have country data to support the implementation of PrEP. And it is the reason that we are all gathered here. We know, thanks to science, that PrEP is highly effective to prevent HIV. But then, we need to get PrEP in the hands of those who need it and who want to take it. PrEP needs to be authorized and it needs to be implemented. And we should all acknowledge that implementation means so many things. Who is going to deliver PrEP? Infection disease doctors, nurses, community stakeholders, GPs. Where is PrEP going to be delivered? At the hospital, at community health centers? Who has access to PrEP? What are the eligibility criteria in each country or according to different guidelines? How to deal with PrEP deserts? How are PrEP awareness and demand created? And since the communities concerned by this prevention tool are frequently discriminated by society and by health systems, is PrEP going to reduce stigma and discrimination, or it will be another opportunity for intersectional stigma? So many questions. This is why at the PrEP in Europe initiative, we wanted to facilitate and provide the space to all those involved in making PrEP become a reality. First and foremost, to acknowledge the place and the expertise of communities who are the best placed to guide effective strategies. Second, to facilitate the exchanges among us with the aim of contributing to better access to PrEP within Europe and not only in the European Union. This summit, therefore, provides opportunities to share our experience, the challenge, the success, and then the challenge again. To close, I want to stress the fact that the countries that are represented in this room are at different stages of PrEP implementation. Some are fighting for authorization, others are working for implementations, others are working towards upscaling implementation and access to other populations like sex workers, migrant women. All of us are still learning and improving, even those who already have PrEP and are successful examples like France. There is still a lot of work to do, so let's go to work. Welcome.